Welcome back to The Price of Business. I'm your host, Kevin Price, talking to you about you and your business. Got Dr. Geetinder Goyal. He's a regular on The Price of Business. He's got an interesting practice called OurWayHealth.com, and he's really part of a revolution that's going on in healthcare that I've been partnering with him on, and it's been really exciting, and I'm very delighted that we can do this. He was, by the way, on a recent Price of Business television show. He was on just on Sunday, in fact, and it went extremely well. 38 million homes around the country, and getting that message out there to that larger audience. We're having lots of fun with it. And then we continue our conversations with people on the radio program that are also making a difference in improving the quality of healthcare. And that's really, we talk a lot about free market healthcare, Dr. Goyal, but the reality is that we're really just talking about bettering healthcare, improving healthcare, and the relationship between doctors and patients, and really making it more sensible and more accessible is a big theme of that. And today's show, I think, is going to be very interesting to the listener out there because we're talking about accessibility that I think makes so much sense and really kind of fun as well. And so talk about a little more about Our Way Health, and then introduce your guest today.
Thank you, Kevin. It's glad to be back here again. And you're absolutely right. We are trying to learn ourselves about bettering healthcare, bringing more transparency into the system, improving accessibility, and sharing that information with our audience. Through our practice, Our Way Health, what we are trying to do is make primary care ineffective again. Over the years, we have seen that primary care in our country has become more and more ineffective, more and more inaccessible, and that really starts the process of the costs going up. Mm-hmm. And I had the pleasure of meeting Thomas McDonald, who recently moved to Houston. He has worked in employee benefits sector for quite a while, and now is part of the Houston community. He joined the Willis group, and his special interest is in medical tourism, which I believe is another area which is going to grow and going to bring more transparency and accessibility into our healthcare system.
We're glad to have you on the program. Kind of give us an overview of what Willis is all about, and kind of introduce us to medical tourism.
Okay. Well, Willis is a large global broker and consultant for employee benefits. We recently merged with Towers Watson. That's been in the news quite a bit recently. We're now a large $8.2 billion company in over 120 countries. Our clients include companies that are, we have 85% of the Fortune 1000 and I believe 90% of the global Fortune 500. So we have clients all over the globe. And I've been involved in helping to spearhead a new service that we're offering. As Geetinder mentioned, there's an industry out there that's about anywhere from $35 to $55 billion a year in medical tourism. What we're doing at Willis Towers Watson is bringing this into the employee benefits realm from a brokerage and consulting standpoint. And as Geetinder mentioned, what this does is it allows companies to improve their transparency and cost predictability, as well as significantly reduce their cost.
Yeah, makes a lot of sense. By the way, the website is Willis, WILLIS.com. Dr. Goyal.
So talk a little bit more about medical tourism, Tom. How, maybe using even a case example, if you can, why should large employers, especially self-insured employers, be looking towards medical tourism on adding that as an employee benefits? You mentioned, transparency, but what does it really mean, when it comes to, let's say, day-to-day accessibility to care?
Sure. I think any mid to large company, let's say 2,000 employees and larger, should take a look at the opportunities that are provided through medical travel benefits, as I call them. And how that works is if you work for a particular company that has this benefit and that person needs a hip replacement, instead of having that done locally for, say, $60,000, they can travel to one of our highly selected and accredited network providers somewhere else on the globe at a significantly reduced cost. A lot of times the cost savings are over 50%. And we've seen companies that have done this before reduce their total medical spend by anywhere from 10 to 15% in total, which is very significant.
Yeah, that is huge. And what started off, I'm sure, originally was individuals who simply thought, hey, it may be cheaper to do healthcare here. It started on an individual basis, but now it's becoming a part of whole healthcare systems, isn't it?
Yes, it's been around for decades, and it's been predominantly driven by individuals. And there are some companies out there offering it as a benefit. But I believe Willis Towers Watson is the first to really incorporate this into benefits management consulting and brokerage. The other players out there tend to be what they call facilitators and people who are third parties to the process. We can, as well as Willis Towers Watson, we can integrate this with your overall benefits program and provide a complete technology platform that provides end-to-end integration of the services, dashboard and analytics that come along with this, and metrics that show the return on investment and the patient and employer satisfaction as well.
Mm-hmm. Very good. Geetinder?
This is excellent because, you're not just buying product, you are, getting all the services that go along with it. Because I guess accessing somebody overseas, you have to make sure that there is the quality component to it, and all the arrangements are made for the beneficiary in this to receive care, and then also maybe transition care back to our country. What is exciting to me is that this kind of movement really puts the pressure back on the healthcare providers here in our country to start maybe bundling prices for, let's say, hip replacement, and start offering cash bundles, discounted prices locally, because otherwise we are losing patients to markets outside.
Another industry that's being exported overseas.
Yeah.
I think you're absolutely right, and and a lot of it has to do. I had a guest on recently who was talking about how we need protectionism here in this country, and protection. It's like we don't need protectionism here. We need to figure out systemically what's going on in this country that makes the United States less viable, be it in the production of better, cheaper cars or oil, or in this case, healthcare. What can we do to make it more competitive? Let's remove the barriers to competitiveness. Let's not treat the American people like they're stupid and don't have the ability to go to health, elsewhere to get whatever they want, regardless of whatever that is. And so I say props to companies like Willis for being so forward-thinking. I think it's pretty extraordinary.
Absolutely.
Thank you very much.
Yeah, I like that a lot. By the way, my understanding is that certain countries are better for certain things. Is that true? Is that what you're finding?
Certain countries are known for, specialty treatments. Yes.
Yeah. Can you give us an example?
I believe India is one of the primary providers, as well as the Cayman Islands, Thailand, Costa Rica, some of the other, Malaysia is a big player, Turkey. I know that the Cayman Islands is very large in cosmetic surgery.
Mm-hmm. Mm-hmm. Our guest today, Dr. Goyal and I, again, we're delighted to have him on. He's with a company called Willis Thomas McDonald, and the company website, willis.com. You recently were acquired, and so you're part of a larger conglomerate. What is that new name?
That's Willis Towers Watson, and the new website is willistowerswatson.com.
Here you go. But I will say willis.com will get you there too. So you might,
yes, it will.
If you got a memory like mine, just remember Willis.
Yes.
And you get there. Geetinder, of course, can be found, Dr. Goyal, at OurWayHealth.com. OurWayHealth.com. And final thoughts before we wrap it up, Dr. Goyal.
This is great. I think it is exciting for us, Kevin, to learn about all these new innovative ideas that are being explored by companies, by employers. And I think it all comes down to, again, well, we keep talking about that we need free market in healthcare.
That's right. Competition makes everything
competition better. Let the buyers and sellers connect with each other. So we bring transparency to the system, drive up quality, and drive down the costs.
I love that. Drive up quality. We never hear that. So I love that idea. All right. When we come back, we're going to have much more for you. I do want to remind you, best content here shows up over there at usdatareview.com, including this great interview. While they're like it on Facebook, follow it on Twitter.